Welcome back. In today's Health Matters with TSET, health coach Dottie Small is covering breast cancer awareness in Oklahoma. It is October, and here's what women need to know.
Unfortunately, there are many factors out of our control when it comes to our risk of breast cancer. But there are steps patients can take that can change the trajectory of their diagnosis. What are the latest numbers with breast cancer in Oklahoma?
Well, when it comes to the incidence, we're just a little bit below the national average, but that doesn't mean that we have less breast cancer. That just means that we're probably just not detecting it because women are not getting screening studies. So it's an inverse relation because our mortality rate is higher than the national average. So that's where you realize, okay, it's not that we're having less breast cancer, it's just that we're probably just not diagnosing it, and definitely not diagnosing it at an earlier stage compared to the national average.
What are the most common risk factors when it comes to breast cancer?
I will say the highest risk factor is just being a woman, right? When you look at men and women, if you're born with two X chromosomes, right away, that's when we hear around this month, 1 in 8 women are going to get diagnosed with breast cancer. Then after that, you have other risk factors, such as the age at which a woman goes through puberty, age of menopause, how many kids they've had through their life. And some of those are modifiable, some of those are non-modifiable. Family history, of course. Nowadays, genetic testing is so much more accessible and cheaper.
What are some screening methods that you recommend for people, and at what age should they start going?
As a general rule, from the American Society of Breast Surgeons, we say every woman from 40 years and older should get screening mammograms every year. Breast cancer is a disease that is very curable, right? We used to say triple negative breast cancer. It continues to be one of the more aggressive breast cancer, but now we have immunotherapies, chemotherapies. When you're diagnosed with breast cancer, it's not a death sentence. I try to use this diagnosis as a wake-up call. I'm like, listen, you're not gonna die from breast cancer. But if we don't change all these aspects in your lifestyle, your risk not only of a new cancer, but your risk of recurrence are gonna go up.
What are some of those things that we can do to reduce the risks?
Not smoking, not drinking, adequate diet, adequate nutrition, exercise, physical activity. There's a lot of research being put forward in that area to really, study and analyze, all right, how can we further reduce the risk of a woman? And really lifestyle changes can make a significant impact.
Important information there, certainly.
It really is. And October is Breast Cancer Awareness Month. Don't forget buddy checks, call your girlfriends, make sure you have an appointment. It can be life